terms of services, are there any links here from this into other websites, or is it just a standalone?
No, there are, in fact, one of the key purposes of the course is to act as a bit of an organised index into both local sources of information and services available to support carers, and also national links as well to national bodies and organisations. So that's if you remember when I was talking about the third section,
yeah.
I mentioned that's very largely about looking at the outcomes carers have identified as wanting to achieve, if you like. And then each of the authorities we're working with is providing us with a form where they detail all the local services, a lot of web links in there, and it's all very local as well. Any questions from all of that? Do you think it looks like something that might be useful for the staff in here?
Can I just clarify, Peter, you mentioned the rollout of this then initially is to health staff?
And local authority staff.
And local authority staff.
So the hosting arrangements to be met jointly from the new carers measure money. So, so we've got the 3 authorities and the health board, and then Powys are on the verge of doing this same agreement.
But it's been hosted by
yes,
your company.
Gives us a year then to see what the hosting arrangements might be at a regional level.
Okay.
And I think the key element is, where our main NWIS comes from, which is our main health board component of IT. They're very interested as well, but they were looking at the All Wales element. At least the year then give us an opportunity to bed it down in Dyfed Powys, and then we'll see what will follow. I know that 3 other health boards have been in touch.
Yes.
In terms of, that, so there has been a shift. I'm sure that, Valentia are very keen as a trust, which is key in terms of cancer services and the amount of carers they come across. And I think ABMU, Swansea, obviously very keen.
Yeah.
And I think Cardiff, no, is it wrong? It's Cumtaf.
Cumtaf for all.
So we're getting there. I think Betsy are moving towards this type of work as well. So, but again, give us a year, perhaps everybody be on, we can look at an All Wales solution then in terms of taking it forward, hopefully from next year. But at least we've got the year lead up now, and it's making best use of the resources that were specifically around raising awareness amongst NHS staff in particular. But this will be open to local authorities by virtue of it being a partnership initiative, and extending it to the third sector as well, because we've got some key providers and organisations out there who are keen in identifying as well. So,
yes.
And it's the wider issue, isn't it, in terms of other staff we need to bring on board within primary care and others as well. So it's good stuff.
You say year 1 we're hoping for 3,000, which would be great. Is that the licences for 3,000, so those staff could be from anywhere, or can we just keep promoting it and rolling out as much as possible?
That's 3,000 maximum across the 4 authorities then, so that's the 3 local authorities and the health board. And then obviously if we see that target is being reached, etc., we can then negotiate in terms of do we need additional capacity. So it's
just to clarify, there is a slight distinction there between the licence, which is how many people you're allowed to deploy the course to, and the hosting fee, if you like.
Yeah.
Because a lot of the organisations we deal with, they already have their own learning management system, their own infrastructure in place, so they want to deploy the course through it. Now, the Hywel Dda region have purchased a site licence for the course, which allows them to deploy to an unlimited number of staff, and even to members of the local community if they want to do that. In the English version, of course, for example, Dudley, that was one of their key objectives. They wanted to bring the community as well, carers, people being cared for, up to speed with all of this.
So it could go on all of our intranets.
Public-facing
websites,
yes,
for the public to use through any of our portals.
Yes, yeah, that's right. That's how most of the, not all, but most of the authorities in England who've taken up the course have deployed it to staff through a learning management system, so they can track usage and chase people up, frankly, and so they've got a record of who's done what. But then to the public, they just made them available through their public-facing website. So, for example, if you went on Google and you typed in Dudley Carer Aware, one of the first links would be to the launch page for Dudley's version of the course on their public website.
And just to clarify, that the main reason why we've come to the conclusion of citing it
through the LMS for the learning management system, is that the discussions we'd had with all of our partner organisations was that there wasn't enough certainty we could manage the amount going through to give us the learning management information in that first year. No one of our IT really felt confident enough yet to be able to promise they could deliver the results that we will need to report on to Welsh Government. So that's really why we've taken this year to give ourselves a chance to really embed it and then work with our own IT systems. And then we will host, hopefully, all of the systems and all the other modules as we go forward.
Great, thanks. So the people that are going to be, are they going to be invited to complete the course? How is that going to work?
What we've done with each of the training managers for each of the partner organisations, we've asked them to start identifying the staff, their priority groups to start with, because obviously, you know, if we have 3,000 in one go, it'll be a very big exercise to get all of those people with their passwords and their access links, obviously. So we've asked them to start identifying priority groups they want to put through first, and then build that list behind that. So there's a constant rolling programme with more people to be registered, and then we can start looking at the numbers that are completing, because we've got to also monitor how well they're doing and the rates of completion. We've got to work with managers if the group of staff that have been put through, if we're not getting through it, we need to be able to go back and discuss that. But we're also then, obviously, if we've got groups of staff, as in our case, we're working with our library service, and they'll be one of our first groups that we want to put through. What we hope is we can get an entire team through, so you're actually accrediting a whole team. So you can say this particular service has attained care aware status. So that again gives you the opportunity to work on a team level as well as individual level. So at the moment it's the request is out there asking everybody to get that information back, and then Jane and her communications officer for this first phase up until the end of the financial year are going to be helping to manage and facilitate that process of the links for the passwords. So we've got a system between now and the end of the year to get that first cohort through, really.
There are some sort of nice little features as well in the LMS, the back-end database, if you like, where you can produce reports and you can just filter on people who haven't yet completed the course, for example, and that comes up with a filtered list of the
Part completed.
of the guilty parties, and then you can fire around an email to them. You can just hit a button and tap up a gentle reminder that they've maybe got another month or two to complete it. So just to keep it on the agenda. I mean, from past experience, I'd say that's where a lot of e-learning initiatives can fall down, because it is so accessible. People fall into sort of Mannion syndrome, and they just constantly think, oh, I'll be there tomorrow, I'll do it tomorrow, and then they forget about it. But if you can kind of just give them gentle nudges from time to time, you can get a much better level of take-up. You know, they can treat it like any other training resource really that they've been asked to do.
We really think that driving this through, it's no good just having it there. It's actually got to be driven, and there has to be real commitment from training managers and team managers to get it into the workforce and into the culture.
Yeah, I agree with the statutory workforce. I think a lot of carers themselves would be really interested in, you know, finally identify themselves and get some support, but they still actually don't know all of it's out there and a really good reminder of their rights. And you might be accessing this or attending a carers group, but did you know about these other 5 things as well?
Yeah.
So I think they'll probably want to do it more, but there are some people that you'll have to tell to do it.
And I think that's the way that we're really using this next 6-12 months as that opportunity for us to build on it gradually and then respond when we see how some of that filters through. And there is also the opportunity that if you've got groups of individuals where you need to bring them together in a group setting, like we're going to do upstairs, there is that opportunity as well that you can put a support in and do a group session as well as individuals. So it does have that flexibility. It doesn't have to be one or the other. It can be a combination based on the area you're using it.
Bearing in mind that in all our organisations our training units are going to be under pressure to train on hundreds of things, mandatory and statutory training, as champions, and there's quite a few of us here,
can we help with that? I mean, we probably need to help keep motivating the training units, don't we, to make sure that this is on the top of their agenda and provide those cohorts that it would be useful to start with to roll it out.
Yes, that's going to be absolutely crucial to us being able to...
Otherwise it'll just wither on the vine
Yes,
with
very
all
much
the
so.
others.
And I think it is that continuous relationships for the most senior people that we have and our champions that we have to be very interested in what is happening, how is it going on, what are the levels of completion, have we got areas who are struggling to find the time, what can we do to help them with that, and just keep it very high on the agenda as we go through this first stage, really.
Big selling point of the training department was the LMS, wasn't it? The fact that they would have meaningful data coming back, which departments, which wards, etc. And then we would be able to identify that at strategically level, and say there's a particular area that we have no input at all from, we could go then through the sort of management system and to ensure that that was raised its profile. But on the whole, it's been well received by training departments, but it is doing a lot of the elements. You know, I don't think they've had the capacity to develop it and to actually take it forward internally. And I think that's what this year gives us, because then we might have something a little bit more structure around it, around the hosting, etc. in year 2. But at least we've got a year 1 where we can really evaluate it. We've got, you know, we've had 72 people go through it in terms of, you know, that's the starting point. But obviously there are lots of people there who can benefit from it.
The other important element, I think, is speaking as a member of a local authority, is that our effectiveness and efficiency in knowing what's going on and giving us more education, if you like, will lead to far better scrutiny. It will lead to far better understanding of what's going on around us, and we can be far more robust in that we know what we're asking. So I very much welcome this, and I thank you today for the opportunity of sitting in, if you like, and listening. And I don't know if I'm putting my head in a noose, but I'm looking forward to taking part in this, because certainly, I mean, with the elections having been in May, there's an awful lot of new councillors out there as well, who may know even less than I do. So I thank you all for this, and I do look forward to it.
I just like to say, speaking on behalf of somebody else from a local authority not usually considered in the group of social care, I represent the library service at Kensington. This kind of interactive e-learning programme where people take a lot of responsibility for their learning will, I think, help them shake off that pass the buck syndrome, whereby they'll refer you to social services, or you're a carer, you probably need to speak to someone in social services. They'll be sort of empowered by the information, and they'll take responsibility for actually being able to help the person in a more direct way. In terms of something that's a library service, which isn't usually considered a social.
Well, Dudley actually promote their library service as one of their interfaces with the public, so that's, you know, they really consider that's a very important outlet. So that's
The wider partnership, isn't it? It's the wider elements.
Definitely, when you consider that libraries are one of the most well-visited public buildings, and I know from personal experience that we have a large number of carers using library services.
And I think the other thing that I would say that we hope during this year is that, as we've said and discussed with our training managers, is this isn't the only source of training there's going to be. Over the period, we're going to need to look at what other specialised training, what other traditional forms of training will there need to be, what other groups of staff will need levels above that. And that's why we're looking at the other modules, not just the young carers, but looking at carers' needs assessments. But there may also be, in condition-specific training within the NHS, there may be additional training needs that will be identified, and that will then help training managers identify what additional levels we'll be looking at in the next 18 months. This is a way of starting to identify some of that as well.
And they can just be added on into the package. Potentially.
we think it's flexible as a sort of stage 1 training. It's flexible in delivery. It could be form the basis for a management team meeting. It could be a group training session, or you could just have people to access it when they can and go through it. So we think that flexibility is really important in raising the profile.
Why people complete the training is their feedback, that people can say, it looks like it's really engagement, but if they think that a certain aspect's been missed or something, can they feed that in through?
There's an option at the end of the course where you can link it in to a survey, any survey that you like to. So at the very end of the course then there's a pop-up window that says please take some moment to tell us what you think about the course. As I said, because we haven't rolled this out yet, we haven't done that yet, that hasn't been set up yet.
Well, we have got the draft for it actually.
Yes.
Yeah.
And, pretty much all the authorities that have already deployed it have taken up on that. They use something like SurveyMonkey, so we kind of refer to that to a page, and then they can go in and track people. Yeah.
The actual pilot that we ran last January, February, the feedback from that was more about young carers and more about carers assessments. So, you know, we are building on the original course quite a lot.
I guess in the future, if there's any scope to look at the public and community access, you could use that to also monitor who is you know, are you a carer yourself or are you just interested? You know, could you use some stats on that too? Because you do want to know what type of people are learning about carers.
That's exactly what we plan to do. In fact, on a public-facing site, that's one of the first questions is how do you describe yourself? And it'd be quite interesting actually, they don't do this, but to compare the figure before and after doing the course, because that's one of the best bits of feedback we've got when people actually say, oh, I think I'm a carer, and they didn't kind of realise that before sitting down to do the course. So it'd be an interesting kind of measure that, I think, if you were deploying it to this.
I think it'd be interesting at some point, again, for the private sector with care workers and, you know, for them to identify, to do it as well, because there is that whole, you know, the issue which it clearly says, you know, the difference between a carer and a care worker, but in the public, you still have the word carer used for care workers, and it's going to be really hard to overcome, but it'll be a step in the right
It's very interesting for me because I'm learning to use the mouse. I don't get on with the mouse very well to start with, but it's easy and good to use, and it gives you the facts, amazing facts to be honest with you, facts that we don't normally think about, so we're getting to learn a lot on it.
I think it's really clear. I don't know anything about carers measure particularly because I work in the training department, and I'm learning quite a lot from it. I think it's really straightforward.
Yeah. And what's your thoughts on the course?
It looks really interesting. I think it'd be a useful way for people to go through it and understand more about the carers. Where, you know, I just think it is really useful. Finding my way through it is quite time consuming. I think people would need to give time to be able to do this. But no, certainly very useful.
What are your thoughts on the course so far?
It's very interesting and useful. I've seen e-learning that's been really boring and like words on a screen, so it's quite nice to be interactive, and I'm just looking at some carers like examples that, you know, like stories. It's not just saying, you know, giving you the information as really bland. I think it's quite interesting, and you can do little quizzes as you go through. And it looks a bit fun actually, but I haven't got any sound with it. But it's pretty good on the visual. And I like it's got links to other things of information.
Is there anything that you'd say where any improvements could be made that you think of so far?
Yeah, I said to, is it Steve? I said that it's got some links to further information, but it's not quite clear they are links because they're just in blue and underlined, and somebody that doesn't use a computer might not realise that's a web link. So maybe there's a little icon they could put next to it which, you know, clearly shows that that's a link to information that they can then follow to find out more. That's the only thing I found so far.
Okay, thank you very much.